Hi, I'm Dr. Lydia Sosenko, provider of oral appliance therapy for treatment of snoring and apnea. I love to help patients with their snoring and apnea issues. I've been working with snoring and apnea now for 20 years, and one of the most common questions I get is, how do I best clean my oral appliance, or how do I keep it clean? If you've been wearing an oral device for a while, you'll know that after a while they could get discolored, have buildup, and things like that. So we're going to be going over some detailed instructions. I also want to mention that today's videos will be for the professional oral appliances. Those are the sleep apnea and snoring devices that are not self-made, that you buy and buy. These are made with the help of a trained dentist, somebody that's trained in not only dental issues, but also with airway breathing disorders, hopefully. So again, these are not for the boil and bite self-type devices. These are made for professional oral appliances. Now, a couple things. There's over 100 different devices on the market. These are just a couple. Sometimes there are two individual pieces like this. And again, sometimes there's two pieces, but together with a strap or a tube or a hinge or something like that. I myself have worked with over probably a couple of dozens of different devices over the years, but there's over 100. So please ask your sleep apnea dentist who provided you the oral appliance if these instructions apply. Secondly, I will be creating an online resource in the video description. Here, if you click on that resource under Healthy or Cleaning Resource Guide, that's where I'll be trying to update as it becomes available to me to specific devices and which of the parts of this video is recommended. So there are basically, the way I handle this, there's two videos. The first video is on basic cleaning instructions. Okay, so this is pretty much valid for the far majority of the 100 devices on the market. I don't think it'd be distributed by a lot of different dentists out there. So this is also to help others dentists and their patients. Second video I created was a part 2 weekly cleaning. Now that cleaning might not be needed for your type of device if it's more of a dense material, or some laboratories might not want you to do that and might not get any extra benefit from that. So again, check the cleaning resource. I'll help kind of fine tune which device you might have, but the best absolute thing is to ask your dentist. So let's get started. The very first and most important step to cleaning your device is actually good oral hygiene care. It's important to keep your mouth as clean as possible before you insert your device. So before inserting, brush, floss, tongue cleaning, anything you possibly can to have the best oral hygiene care. For two reasons. Number one, plaque and bacteria can actually transfer onto your device, harden over time, causing an increased chance of the devices actually breaking or the mechanism not working or turning, things like that. So the cleaner your device is kept, the longer span it will have. Secondly, you can trap plaque bacteria onto your teeth underneath the device once it's inserted. That also can increase the chance of other issues such as cavities, bad breath. So you definitely, starting with the best oral care is the most important. Now, I have found as a dentist over 2 decades that most people do not know how to brush or floss correctly. So in the resource link, there will actually be a correct links on the best way to do that from the American Dental Association. The second step to having a clean oral appliance is to clean your device daily after each use. The most common products that are recommended from almost all devices are mild liquid detergents like dishwashing or hand soap. You will also need a soft toothbrush or a denture type brush, whatever type of brush that you feel you can get to all the nooks and crannies of your device. So you want to take either your soft toothbrush or a soft denture brush and either put the dishwashing soap or hand soap directly onto the brush or the device and really just scrub away. Make sure you're getting all inside, outside, all different directions of your device. You want to make sure both areas where your top teeth rest and your bottom teeth rest, and whatever mechanism you might have. Sometimes it's a bar, sometimes it might be a tube, a strap. There might be two individual pieces, so then you would just scrub all directions of both pieces. You want to rinse it out really well, either with lukewarm water or cool water. Rinse it out really well. Shake off all the excess and then put it into your container, usually with the lid open. Sometimes it is recommended also some products that to have a submerged device. So if that is, you want to go ahead and fill your container with clean water, Put your clean device inside your container submerged and then put a lid over that. A lot of patients ask me about using an alternative to hand soap or dishwashing soap. There is Dr. Berland's Clean-A-Dent products, which are very gentle yet very effective and kills 99.99% of bacteria, such as Candida, E. coli, staph, and many more. So it is a very powerful daily cleaning as well. The only problem is not all companies are aware of what this product is. The more I started research, many do say it's okay, but it is definitely something to double check with your dental provider, and they can find out. Also, it does have a small travel size pump, which is very nice. And the only thing, I also do not use it with the ultrasonic cleaner that is recommended on the box on a daily basis. I will bring that up into my part 2 video to use for some devices weekly, but not on a daily basis. If you choose to use Dr. B's Clean-A-Dent product, all you do is submerge a case deep enough that would submerge your device fully in lukewarm water or cool water, and then you would put 4 squirts from the pump of the solution. You let it sit from about 5 to 20 minutes maximum, agitate it a little bit, and then when you take it out, you would then go ahead and brush it just like you would with the dishwashing soap. You just want to get all sides again, including any hinge if there is or holes. Rinse it out really well, and then put it back in the container, into a clean container, either with the lid open or submerged in water as discussed. And again, just to summarize, step 3, confirm your storage requirements per your device with your doctor. To keep your device in the air dry mode or submerged in clean water after it's been cleaned is really up to the specific device. It is definitely a little tricky topic, and it can be confusing because you can have the same looking type device, but if it's made with a different substructure from a different laboratory, the instruction might be different. So that one is definitely best to ask your provider for which, if it should be submerged or dry. And also, I will put some more information on that in the cleaning resource as to what information I discover. For my patients, I definitely do not recommend the following products. I don't recommend using toothpaste. They can simply be too abrasive. There's just too many kinds of toothpaste out there. Mouthwash directly soaking of your device. You yourself can rinse out with mouthwash and spit it out and then put the device in, but don't have your device soaking in that. Don't use baking soda, vinegar, hydrogen peroxide, or bleach, and definitely stick with the soft types of toothbrushes. One extra tip is don't forget to clean the containers. They can harbor bacteria, they can get pretty neglected over time. So definitely periodically, even if it's weekly, go in there, clean it very well, use a paper towel to dry it, a towel. Some are dishwasher friendly, some of these containers. I'll try to put those onto the resource link in the video description of which that I found to be dishwasher friendly. But that's a very important also tip, is don't forget to clean the containers. Finally, it is very important to visit your sleep dentist at least annually, and at that point bring in your device, and if there's debris, very often they can put it in a specialized cleaning liquid as well as in the ultrasonic cleaning, and they can examine your device to see if it is still in very good shape. So that's it. I hope you found today's cleaning on basic daily instructions of use. I hope it's helpful. Now, if anybody's ever talked to you about using a tablet or a weekly type of cleaning, or like a denture type tablets or some kind of tablet form that it's okay to use weekly, you definitely want to come back and see part 2, the how to clean your oral appliance weekly cleaning cycle. And then lastly, I will be also having a video that will cover all the products that are mentioned in both this video and that next video, as well as replacement products, because over time patients just don't know where to get the elastics, or they don't know where to get replacement containers. Sometimes they want a smaller one for travel, sometimes they want a deeper one for the weekly cleaning, things like that, and just the solutions. Sometimes they're a little tricky on where to find those solutions. So look out also for that on a blog and on a video, and that's going to cover a replacement and cleaning products for your sleep apnea oral appliance. So I hope you found today's video helpful. If so, please give me a thumbs up, and feel free to reach out to me through one of the sources here on this next slide. And until next time.